All right, good morning, everyone. I'm Dan Beenken with the UNI Advanced Iowa team. Appreciate everyone joining us today. We continue to bring you our Coping with COVID series here in our webinar format. Sticking to the guidelines of virtual, I am definitely 6 feet away from our presenter today, Lisa Hingst with Accel Group out of, well, they used to just be out of Waverly when I first knew them, but now they've obviously got locations in the Des Moines market and Cedar Rapids market, which is where Lisa's based. And I'm excited that Lisa was able to join us today because of a couple of reasons. One is she's got a lot of experience with P&C insurance and in the manufacturing space, but also because she comes from a company that's dealing with all these issues right now and having to go through them. And so I think she brings a unique perspective of wearing both hats as a provider and also as a user of services and that. And so anyway, Lisa, if you want to maybe expand a little bit on your background, and then we can get into this and answer questions. We have a Q&A box for any questions that folks have. I've already gotten a couple of them emailed to me this morning that we'll be trying to go through here in the early parts of this, so we make sure we have time for them. And with that, Lisa, you want to get us started?
Sure. Good morning, everybody. I'd like to thank you for your time today. Just a little background about me before I get into my material. My background is 27 years in manufacturing. 20 of them were overseeing the safety efforts for many locations. When I left the facility 3 years ago, or the business, we had 8 locations, 900 employees, 8 U.S. locations, and then we had an operation in Brazil that I helped start up. So plastics manufacturing, John Deere's largest plastic suppliers. So 4 of our locations are directly in John Deere's facility. So kind of had to learn the big company rules as far as how you do things. So that's a little bit about me.
Cool, thanks, Lisa. So let's get into this today. We're going to be talking about OSHA, and I've seen a couple things recently being kicked out there on reporting for OSHA from a COVID standpoint. And so if we could, Lisa, you want to get started? I know you have some slides, so let's just start going through those, and as we get questions, we'll take them and answer them as we go, if that's okay.
That sounds great. So just so everybody knows, OSHA is still performing inspections. They're constantly updating their guidelines on personal protective equipment, especially for the healthcare industry, because obviously with the shortages, you got to get creative as to how you're going to protect your employees. They recently released interim enforcement guidance on recording cases, which we'll cover in a little bit. And then they also published interim enforcement procedures, and I'll cover that as well.
But OSHA is not taking a break right now. They are still active. No. They're out there. They're knocking on doors. So don't think that they're distracted, correct?
Correct. They actually stopped at one of our clients' job sites a couple of weeks ago. A construction site asked them for their OSHA logs, their written programs, and all that stuff. They do have some directives out there, especially, if they pass construction sites, to stop and ask them about their programs. So
they're still business as usual. So don't think that you can hide right now.
Right. Yes, they are out there. So yeah, just real quickly, I think everybody kind of knows what triggers an OSHA inspection, but just wanted to update everybody. Imminent danger, obviously, if something is, and this COVID is imminent danger. Severe injuries and illnesses, and then worker complaints and referrals. They came out with direction on enforcement of those referrals, and then targeted inspections and then follow-up inspections, which are probably very low on their priorities right now. So they do have to follow up on all complaints. Typically, if it's not imminent danger at this point, they're going to do it with an off-site investigation, letter or phone call. Mm-hmm. If you look down below, they actually they publish their directives that they put out there for their compliance officers, and anybody has access to them if you dig deep enough, which I dig deep enough. So
Sure.
yeah. So basically, they published their rules or enforcement guidance for compliance officers on complaint priorities, and their focus is primarily on healthcare organizations and first responders. That's because they're considered high risk.
Yep.
And for medium or low risk, they're recommending just non-site visit or inquiries, and that includes general industry, construction, maritime, even retail, things like that. And they'll do it via, this is in their directive, to do it via telephone, fax, email, or by letter. And then the only thing that would trigger for the lower classifications is if they gave an inadequate response.
All right. So maybe they're not going to knock on the door, but they're going to call.
Yep, they will follow up on it. So
Okay.
yeah, so here, like I was saying, here's the beginning of the intro of the guidance. It just came out on the 13th. They're constantly updating stuff as far as how they're going to respond to different things, all COVID related. So yeah.
Okay, so here we get into it.
So I don't know if anybody has had anybody test positive, but the Trump administration came out with this guidance, which is to the dismay of OSHA a little bit. And it's basically, is it more likely than not is the litmus test. And if they're in healthcare, emergency response, those sorts of organizations, it's more likely than not that they probably were exposed while performing their job.
Yep.
But if there's areas where there's obvious community transmission, could have been the exposure, the only way those general industry type or construction should consider it work related is if there are multiple cases of people working closely next to each other, and closely is 6 feet, within 6 feet for 30 minutes. That's kind of what they say for the exposure. And then, or if there's information available to the employer that would tell them it's more likely than not that it happened in the work environment.
So if you've got one case, that person is sick, not non-reportable.
Correct. Yep.
Yep. And is there guidelines for Jimmy got sick 2 weeks ago. He's better now, but now Sally is sick. How does that come into play, or is that still kind of gray and vague?
It's still gray and vague, and they're not going to enforce it for general industry type things. Yeah, and I think you just do your due diligence as far as trying to say that it's more likely than not that it was out in the community transmission.
Okay.
So,
okay.
Yeah, and because it's an illness, you want to, if you do have an issue or an incident that you are going to record, it's a privacy case. So you leave names off of it and just put privacy case and have a different log somewhere else.
Sure.
Since that can be public record. And common cold and flu are not recordable, but they have come out saying COVID-19 is a contagious disease and it is recordable if you deem it out, if you feel it's work related. And OSHA is coming out with guidance on preparing places. They talk about who's a high risk industry, who's a medium risk, and who's low risk, and then how you can prepare your business based on your risk as far as that's concerned. And that's available out there. At the end of this, I have links that to these things that I'm referencing during the presentation. So
this is guidance on how to set up your workplace to create a safe environment in the face of COVID. Essentially, is that what we're talking about? The 6 feet.
Correct.
Providing hand sanitizer type stuff and where and how and all that.
Yep, and what you need to do based on your hazard group, if you're high hazard, medium, or low.
Okay.
Yeah. So, and this is readily available if you type in Google OSHA Guidance workplace, this will come right up top. So the next thing I want to cover is, so what are the applicable standards regarding OSHA? And they've got their catch-all, which is the general duty clause, and it basically says employer shall furnish each of his employees' employment in a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm to its employees. So if there isn't a standard that they see a gap in on what you're doing as an employer, they're going to go to general duty. Other applicable standards, and I tried to include general industry and construction standards. They want you doing a hazard assessment to understand what PPE your employees should be using in the face of COVID. And I know they come out with pretty much a directive. If you are an essential employer, they want you putting masks on your employees. They want them wearing those or even putting up barriers or things like that. But they do want you providing PPE to your employees that go beyond your normal exposures of like glasses or hard hats and things like that. They want you providing the mask. So
okay, that's one question that we got in earlier, Lisa, was on the, there's such a broad range of what's considered essential right now. I feel like, most manufacturers are producing and whatnot. And this is from a manufacturing firm, a smaller one. Are they required to be having their employees wear facial masks and PPE, or is it a suggestion at this point?
at this point, it's a strong suggestion, especially if they can't social distance more than 6 feet.
Okay.
If they can't do that or it's not available to them, I think a lot of people are getting creative with how they cover their face. I mean, you can use bandanas, things like that.
Mm-hmm.
But even put a barrier between them if you can, if you don't have the PPE, just something that's going to create a barrier for your mucous membranes.
Even a sheet of plywood or something, huh?
Yep, if you can.
Okay.
If you don't have that PPE available. But I was at Hy-Vee earlier this week, and they were selling packs of 10 of those, at least surgical masks. They aren't as great as your filtering face pieces, the N95s, but at least there's something.
Okay, so that's important to know, is these don't have to be N95 or KN95.
That if at all possible, they want N95. But if you are unable to secure that, I do recommend you document your attempts. That's what they're asking, is in the face of not obtaining the recommended, you document your efforts to try to obtain them, and this is why you're using maybe the lesser barrier.
Okay, perfect.
So in construction, a lot of times, if you see over here, they defer to the 1910, which is general industry for theirs. They'll say, if you type in 1926.33, it'll say it is the exact same as 1910, 1020. Go look that up. So that's why I have those there.
Okay, thanks.
Yep. So what employers really need to be looking at is a pandemic preparedness and response plan. And I have provided a template for this that will be shared with the group, and templates for a couple other things. But basically, things to consider are initially opening it up on your preparedness plan, that your employees are very important and their well-being is your priority. Educate them on the symptoms, and then determine, are you going to have them monitor and report on their symptoms, which most employers have gone to that on a regular basis. They want employees every day. Doesn't necessarily have to be as formal as an affidavit, but there are some that are doing affidavits. There's even self-reporting of taking temperatures. And then if they do have symptoms, who are they going to communicate that to? And then what, as an employer, are you doing proactively to sanitize your areas? Common touch points, things to keep in mind: handrails, doorknobs, handles. That list right there. obvious places. You know, in my previous life, we had standard kiosks that employees would access for work instructions and things like that, multiple hands touching that. So how are you, I would say you provide gloves if you have common touch points, and then every day or several times a day, you're wiping these things down.
Okay. And I know that we're going to make that template available online along with the archive of this for those that weren't able to watch it live, so they can see that. Is that something you're advising your clients? Is that something that OSHA is strongly suggesting or almost requiring at this point, that you have some documentation of how you're...
OSHA will ask you, do you
Okay.
have a pandemic response plan? They will ask you straight out.
Okay.
So it's in your best interest, and it's written pretty generically and pretty easy. So it's not necessarily setting people up for a whole unreasonable amount of things that they're doing. It's just what they can do. It's a very easy template to kind of customize to fit to each organization.
Okay.
So other things you include, what steps are you taking to reduce the spread? You know, obviously posting signage, and there's stuff out there on CDC's website. Off to the right, there's one of their postings that you can print off.
Yep.
Are you allowing them to work remotely, or are they social distancing at work? Are you going to stagger your shifts? You have hand sanitizer and hand washing, just those things that you're doing to help mitigate the spread of the virus. And then what do you expect of your employees if they're exhibiting symptoms? And then as an employer, if you see someone exhibiting symptoms, you know, what are you going to do? You're going to send them home, you know, until they can certify that they haven't had like a fever for 3 days. And that takes a little while to get over. And then again, how are you going to communicate it if someone tests positive? You got to keep the identity of the individual confidential, but you got to notify people that they've been in contact with in the last 2 weeks. So how are you going to do that? And then how are you going to shut down and then sanitize, which is recommended for everybody if you have a positive case? And then again, what are the health requirements before you allow someone to return to work? So those are all things that you want to cover in your pandemic preparedness response plan. I have a couple of updates. Oh, go ahead.
I was just going to say, we had another question, Lisa, on the communication to employees of a positive case. Do you have any examples of how companies have handled that? What information they're able to share? And she's asking here, you know, how do you, if you're a smaller employer, you know, you're protecting their identity, but obviously it's going to be somewhat easy for people to figure out who it is, type of thing. I'm just wondering if you have any example, or they're wondering if you have any examples you can share on that.
I don't have any straight up examples, but we have I have a sample letter I can share, which I didn't include, but I can get that out. But it's basically well, I guess I do. We had an employee exposed to someone who did test positive, and they sent out an email to, if you have the ability to send out an email to the group, not saying who was the person that was exposed or anything like that, just be advised and pay attention to potential symptoms you may be experiencing for the next 2 weeks. And on this date is when the exposure took place. So the incubation period is this, and monitor.
Are you able to say a department or area or shift, or, you know, what kinds of identifying things can you give, so maybe to put some employees at ease, or you really shouldn't do any of that?
You really have to keep it as generic as possible to
Okay.
protect their identity.
Okay.
Yeah, it's just someone was tested positive, and you may have been exposed to them. Monitor your symptoms.
Okay.
So, yeah, I mean, you well, with ADA and EEOC, they have thrown some stuff out the window where you can ask those personal health questions, but once you have a confirmed case, you have to maintain confidentiality at all, any way you can.
Okay. Another question here on positive cases. Do you know what level of involvement the health department will get involved? Do they, is there a certification of you can be back open again? You've done the right things from a cleaning standpoint, or is that kind of a self-monitoring process? How does all that work?
That's a self-imposed process, but they will want to know what you've done to sanitize, but it's up to you to determine how you do it. And there are area businesses that will come in and do it for you if you don't want your employees to do it as well.
Okay. All right, I think that we're up to date on some of the questions here. Thanks.
Okay. Yeah, so that's kind of what I had on the pandemic, but just also wanted to touch base. Even though employers may not have to record it on their OSHA log, some states with the shelter-in-place law Illinois came out 2 days ago and said, if we've got a shelter-in-place and you have an employee that is an essential worker, an essential employee, and they're required to come into work and they test positive, we're going to assume it happened at work because we're in shelter-in-place, and that's the one exposure they've had. And they put the burden on the employer to provide objective evidence as to why it wouldn't be work-related.
Okay, so then documentation and process is incredibly key there to be able to showcase, hopefully shift the burden outside of the company walls.
Yep, they expanded it to all industries that are continuing to operate under that essential employee description or definition. And so on this, that's where they expanded it, and I included a little snip where it even says down here, transportation, and they even have educational institutions, daycares,
Banks,
manufacturing. So yeah.
Pretty wide swath. Most everybody.
Yeah. Yeah. And I will tell you, they, with the shelter in place as an employer, what you want to do to prepare for that. So where I worked at previously was my family's manufacturing business, and they have facilities in Wisconsin, and the police showed up at the door at their facility in Wisconsin and ordered them to shut down until they could prove that they were an essential manufacturer, an essential employer. And again, being a supplier to John Deere, we happen to have that letter, and same with Toro and Caterpillar, have those letters to be able to show it. They have stopped employees going to work. So some things that you look off to the right, sample letters that I have provided that will be available to you guys is, so get letter from your customer. If you think you're an essential employer supplying an essential employer infrastructure, have letters from them. Have a letter to your employee regarding the fact that they're an essential employee critical to the infrastructure, and then issue them a letter on their right to travel for work, and then with contact information as to who they should reach out to within the employer's facility. It's typically the HR department, but
yep, I've seen where they're giving that to people to carry in their car, kind of like their car insurance form and everything else. So okay,
right, yeah. So some links and resources. So OSHA has a COVID website, and again, all these websites are updating regularly. We've all seen how it's ever evolving by the minute, things that are going on, but there's even OSHA news and updates. So when they post those news releases, that's where you can find that. And then there's CDC guidance, and they do try to be particular on industry as well. And then there's the full text of the enforcement of COVID compliance, but again, focusing primarily on the healthcare industry, and then how to prepare the workplace, and then guidance on essential critical infrastructure workforce. That is where they actually put together who might be considered an essential critical employer.
Okay. So there's their definitions right there, and probably specific NAICS codes and industry definitions.
Yep.
As
They don't include NAICS codes, but they just put basic general industry descriptions.
Okay. This is really awesome. So if we wrap up or summarize here, Lisa, by maybe, if you get 2 minutes on the phone with your clients right now, what are you advising them or telling them from the standpoint of all things COVID, I guess?
Basically, if you don't have a pandemic plan, try to focus on that. That should be primary, and then also living up to that plan. But also make sure they have resources available to them for mental health.
Sure.
I think everybody's kind of, even me, I didn't realize going crazy was such a short trip in these environments, but I just, really reach out to your employees and try to gauge where they're at and listen to them. But we're here for you, and I'm here for all of you guys to answer questions as they come up. I've included my contact information. If I don't know the answer, I will definitely work hard to find the answer, because I don't like not knowing, and I don't like not providing an answer. So.
All right, this is awesome. Thank you so much, Lisa. Happy to have you with us today. Appreciate the fact that you have, two unique backgrounds that you can share, being on both sides of the coin as an employer and now as a risk strategist for companies. It sounds to me like it's like a lot of other things: documentation, preparation, communication. Those types of things are applicable here again as well. And so, thank you so much for your time. Thank you for making these templates available to us and our audience. Greatly appreciate that. And to everybody, I hope you stay healthy and safe, and we'll wrap up for today. Thank you, Lisa.
Thank you for having me, and healthy wishes to everyone.
Thank you.